This is Randy Osborne of Florida Government Watch and Florida Eagle Forum. I have with us, in fact, we're in Fort Myers, Florida at a beautiful home. It's called the Burroughs House. And we are here right now with Dr. Karen Effrem. She is a medical doctor, a pediatrician. And we want to talk a little bit about a couple bills that were passed this past session, but specifically there's some underlying issues that I think the viewers need to know about. There was a bill this past session in the state of Florida, was 7026. It was the bill that actually came up that was a result of the Parkland shooting case. And it's where that the legislature actually restricted gun ownership to 19-year-olds and younger. But in addition to that, there's some other things that we want to talk about today. And Dr. Effrem, one of the things that I want you to try to define is, from what we have researched, and there's a website that I will actually send the viewers to be able to see more of this, the information that we're sharing today. A large majority of mass killings and or mass shootings have resulted in very specifically drugs, as just about every one of the shooters or somebody that does multiple stabbings or whatever the case may be has been on some type of a drug. And can you explain what usually those drugs are?
Sure. Thank you very much for having me, Randy. The psychiatric drugs fall into a number of different classes. Antidepressants, drugs for attention deficit hyperactivity disorder, and antipsychotics are the most common, especially the ones used in the student age population. FDA has required in their product labeling, especially for the newer antidepressants, which are called SSRI, which stands for selective serotonin reuptake inhibitors. The labeling states that these drugs can cause and have been associated with suicide, especially in people younger than 24, mania, violence. These are associated, if one looks at the information that has been able to be gleaned from the reports about these shootings and mass killing sprees, that almost every one of the perpetrators has been on one of the drugs.
One of these type of drugs. Now let me understand what you're saying is majority of these drugs do have some type of warning label to some type of violent behavior. Is that what you're saying?
Yes.
Okay, give me some example of some of the names of some of these drugs. For example, I think I saw Prozac as
right.
One of those drugs. And can you explain the difference between that type of a drug and there's kind of actually two fields of those drugs that are being used in children. One is for like children that have attention deficit disorder or something that. Can you explain that also to the viewer?
Sure. The antidepressants like Prozac, Paxil, Zoloft, Luvox, Celexa, those are the 5 most common ones, are all associated with mania.
Okay.
And
mania, describe for the
agitation to the point of being really
violent,
hyper and overexcited, and can in many cases, and there's numbers of court cases where the fact that the perpetrator of a crime has been on these medications has been noted as the reason for the crime.
Right.
And so murders, or sometimes murders and suicides. And it is becoming more and more established in court documents that these are going on.
So it would probably, this is something that's not talked about. This is something that's not discussed anywhere that I know of. I mean, it's very, very limited. Let me rephrase that, of where this is discussed. Our psychiatric organizations, are they looking at this as an issue, or is it just kind of like this is part of a result or something of, we have to treat the person, and this is just a danger that we have to deal with? I mean, what are they doing here on this? Is it?
Some of it is that where there have been lawsuits about this.
Right.
There was one related to the Columbine shooting, because both perpetrators were on different of these SSRI antidepressants at the time. If the cases went forward, they were settled and then sealed, because the drug manufacturers really don't want it out that their
this could be an issue,
cause these kinds of problems.
Can you explain, in your best explanation, of what this does to the brain? What goes on there?
Well, they say that depression is caused by too little of a neurotransmitter called serotonin.
Okay.
These drugs work by preventing the nerve cells from degrading the serotonin so that more stays around. But there has never been a study actually documenting that any neurotransmitter by itself causes any psychiatric disease. And the reason why is because there's hundreds of neurotransmitters, and they act in an extremely complicated manner, so it's really hard to say that serotonin is the problem with depression.
Right.
Or norepinephrine, or, there's a whole bunch of them.
Right.
And it's really hard to say, and there's never been a study to show drugs are successful in treating. And in fact, there was a big series of studies done that called the STAR-D trials, and it showed that this class of antidepressants was only effective in about a third
Amazing.
Of patients, and that they had to add more and more drugs to the issue. And what happens when the SSRIs get going, doing what they're doing, it creates a manic state, which is what you see in psychosis.
Okay.
So it may change their depressive symptoms, but then they're left with being overly wired and manic, and with symptoms of what's called akathisia, which is a very agitated inner sense, to the point where people feel the need to either commit homicide or suicide.
Oh, wow.
And that is why these drugs are under the FDA's black box warning, which is the most serious warning short of a ban for young people under the age of 24. But what has never made sense to me is that how does the brain know that you're under 24?
Exactly.
If these, and there's lots of incidents of older people that have done, have
and it's
committed
been on these
suicide
type of
or
drugs.
Or homicide based on these drugs.
Now, let me ask you a quick question regarding that. You mentioned black box warnings, FDA. That is like the most serious of warnings on a side effect that a drug could cause. Is that what you're referring to?
Right.
that comes down from the FDA and says this is,
Right.
we're going to put this warning on this.
Right. Unfortunately, the doctors still think that they have to use them.
Right.
Because they feel that they would be legally liable if a patient says they're suicidal,
Right.
and they don't do something.
Right.
So often they ignore that warning.
Let me ask another question. These drugs, what can we do? I mean, everybody's looking for an answer to what's going on, and I honestly think it's a moral problem.
Right.
I think it's a family problem. I think it's the breakup of a family nucleus. I think there's a lot of reasons this has caused this, but I think this ultimately has exacerbated the problem, is these type of drugs.
Mm-hmm.
Do you have any idea of how many kids are on these drugs, or what percentage of school-age children, or any of that type of data?
I know that about 2 or 3% are on the Ritalin type of drugs for
Right.
attention deficit disorder. And I do not have the exact percentage of those that are on antidepressants.
Right.
I do not. But I think it's going to be exacerbated. The problem is going to be made worse by even well-intentioned efforts to try and prevent school shootings by increasing mental health in the schools. And that is not the way to go.
That's the next thing that we want to talk about is the mental health. And if you want to stay tuned, we will continue this discussion on the mental health issue. This is Randy Osborne with Florida Eagle Forum and Florida Government Watch with Dr. Karen Effrem. Until next time, God bless.